Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community, where our mission is to get you back to what you love without surgery and without medication. Well, today we are on part 3 of Oh My Aching Back. And remember, as I said in previous videos, that the number one reason that people go to their doctor is why, Calvin?
Back pain.
Back pain,
Yep.
That's right. It's also the number one reason why people miss work, and back pain is a big problem. So, Dr. Calvin, we talked the first week a bit about stretching, and then we talked about proper lifting. So, what are you going to talk to us about today?
Well, I'm going to talk to you about, sometimes you may forget to stretch. Sometimes you may move a certain way. Now you're starting to feel pain and you're wondering what's going on. So, some of the symptoms of, that can happen with you when you move the wrong way or forget to stretch. You can have strains, which can cause hypermobility. What that is additional tightness of your back, which can cause pain and additional tightness. You can have tightness on either side of your back or both sides of your back. So those are signs that something is going on. So when you start getting these different strains and different pain, okay, a lot of people try to wonder, what do we do? Do we use ice or do we use heat? So that's been a big distinguishing of which one we use. So I'm gonna break it down and let you know why, which one to use, when to use it, and how to use it. So with ice, you wanna use ice for inflammation. Now, if your back has a lot of pain and you happen to tap your back and it makes you jump out of your skin, you definitely do not want to use heat on that portion of your back. You want to use ice because that means that you have inflammation. Now, when using ice, you don't want to put just a pack of ice on your back. You want to wrap it in a towel or put it in a pillowcase. Okay? Now, heat. This is what's distinguishing ice from heat. If you want to use heat, that means that if your back is very tight and just a little sore, and when you're bending over, you feel a lot of tightness, just a little pain, you want to use heat, because what this does is it loosens your back up. This way, when you use the heat, it'll make it easier for you to stretch and easier for you to move. Now, I know a lot of you probably thinking about over-the-counter medication. That's fine. Anti-inflammatories, that's fine. Advil, different anti-inflammatory medication. But you only should use anti-inflammatories 3 days for maybe a fever and no longer than 10 days for pain, unless your doctors tell you it's okay. Now, anti-inflammatories is made to be used short-term, not long-term. So now a lot of you guys want to ask, now, what do? Do you keep moving? Do I rest? How do you move? Now, one thing is, you will rest a little bit, because sometimes you're in pain. You don't want to continually to move when you're in pain, because especially if you don't really know what's going on. Now, on the other hand of that, you should also move as well. So you should combine and mix resting, moving. Now, it's the difference between resting and moving is how to move. You want to move in a way where you're not causing additional strain. So you may have to compensate or not do full twisting and bending. You may have to use your hips a little bit until we can kind of decrease that pain.
Well, great, Dr. Calvin. So I think if I picked up a Christmas tree, I had a sudden sharp pain, very tender to touch. I even felt some like swelling there. So in that case,
you will use some ice. You will use
okay.
ice, and you will come see us, physical therapy. All right, so we can kind of determine your best course of action.
Now, another example would be I took a long plane ride from Tennessee this weekend, and my hip and back were pretty stiff. I don't remember doing a sudden movement that caused acute pain, but so in that case, if I'm having stiffness and I feel difficulty moving and bending,
you want to use heat.
I want to use heat. Okay.
All right, so that's the difference. So when you have a lot of pain in your back, even tender to touch, you want to use ice. If you have stiffness and tightness, you want to use heat.
So one question, Dr. Calvin, is how long should I use the ice or the heat? How many minutes should I keep it on there?
All right. Now, typically for ice, you would do it maybe 3 times a day, 15 to 20 minutes for ice. And for heat, you want to do it, you can do it also maybe 2 or 3 times a day, but no longer than 10 minutes.
Okay, good. All right, now, if you've tried those things and you're still having trouble, don't hesitate. We got a great team of people here. We have a great facility. We'd love to have you here at our community. Thanks again for spending time with us. Be sure to share this video with a friend. Go onto our website. There's lots of great information on there. Our nutrition coaching, our athletic program for your kids and grandkids. We've got a lot of books and resources there that are available to you. And share this video with a friend. And we look forward to coming to you next week. This concludes our Oh My Aching Back series.
Yes.
I want to thank you, Dr. Calvin, for being with us. Did an awesome job. And we'll see you guys next week.